Welcome to the Rwanda Medical Academy. Today's lesson is about substances that cause hypoventilation. And we will use the SLOW mnemonic to help you remember all those substances.
Introduction. Hypoventilation is a condition characterized by slow or shallow breathing, leading to inadequate air exchange and increased levels of carbon dioxide in the blood. This lesson will cover substances that cause hypoventilation, simplified through the SLOW mnemonic, which stands for sedatives-hypnotics, liquor, alcohols, opioids, and weed, marijuana.
We'll delve into each component by discussing their descriptions, mechanisms of action, clinical considerations, and management strategies. S stands for sedative hypnotics. Description. Sedative hypnotics include a group of drugs such as barbiturates and benzodiazepines. These substances are commonly prescribed to induce sleep and reduce anxiety. Despite their therapeutic benefits, they carry a risk of causing hypoventilation, especially when taken in excessive amounts or in vulnerable populations. Mechanism. These drugs enhance the activity of gamma-aminobutyric acid, GABA, a neurotransmitter in the brain that promotes calmness and relaxation. By doing so, they depress the central nervous system, CNS, which can lead to a reduction in the brain's ability to regulate breathing, causing slow or shallow breaths. Clinical considerations. It's crucial to monitor patients on sedative hypnotics closely, especially those with existing respiratory conditions like chronic obstructive pulmonary disease, COPD, or sleep apnea, as they are at a higher risk of experiencing hypoventilation. Management. Management includes prescribing the lowest effective dose and avoiding long-term use. In cases of overdose, supportive care and medications like flumazenil, for benzodiazepines, may be used to reverse the effects. L stands for liquor, alcohols. Description. Liquor refers to beverages containing ethanol, a type of alcohol that can depress the central nervous system when consumed in large quantities, leading to hypoventilation. Mechanism. Alcohol impacts several neurotransmitter systems but notably potentiates the inhibitory effects of GABA, similar to sedative hypnotics. This exacerbates CNS depression, impairing the body's automatic breathing regulation. Clinical considerations. Individuals with a history of heavy alcohol use should be carefully evaluated for signs of respiratory depression, especially if they present with other risk factors for hypoventilation. Management. Management strategies include monitoring for signs of withdrawal in dependent individuals, as this can affect respiratory function, and providing supportive care in cases of acute intoxication to maintain airway protection and adequate ventilation. O stands for opioids. Description. Opioids, such as morphine, fentanyl, and hydrocodone, are potent analgesics used to manage moderate to severe pain. However, they are also notorious for causing hypoventilation, even at therapeutic doses in sensitive individuals. Mechanism. Opioids act by binding to specific receptors in the brain and spinal cord, dulling the perception of pain. They also depress brainstem centers responsible for controlling the rate and depth of breathing, leading to hypoventilation. Clinical considerations. Patients on opioids, especially those with a history of respiratory conditions or when initiating therapy, need close monitoring for signs of respiratory depression. Management. Management may involve using the lowest effective opioid dose, considering alternative pain management strategies, and having naloxone, an opioid antagonist, available to reverse respiratory depression in cases of overdose. W stands for weed, marijuana. Description. Marijuana refers to the dried leaves, flowers, stems, and seeds from the cannabis sativa or cannabis indica plant. While often used for its psychoactive effects, it can also cause hypoventilation, particularly with high doses or in edible forms. Mechanism. The psychoactive component of marijuana, THC, tetrahydrocannabinol, affects the brain areas that control breathing. While the exact mechanism is not fully understood, THC is known to alter sensory perception and may indirectly reduce the autonomic drive required for normal respiratory function. Clinical considerations include the potential for increased risk of hypoventilation in individuals consuming large quantities of marijuana, especially in forms with delayed onset of effects, such as edibles. Management.
Education on the risks associated with high doses and potent forms of marijuana is critical. For those experiencing respiratory distress related to marijuana use, management is supportive, ensuring open airways and adequate ventilation. Conclusion: by understanding the SLOW, mnemonic and the substances that can cause hypoventilation, healthcare providers can better predict, identify, and manage patients at risk, ensuring safer therapeutic outcomes. This comprehensive approach helps in addressing the complexities of hypoventilation, emphasizing the importance of dose management, patient education, and close monitoring. Thank you for learning.